Hello, I'm Dr. Shirin and I'm the Medical Director of Elite Aesthetics in Kent, and I'm also a UK trainer for the Priapus Shot. Today I'd like to talk to you a little bit about erectile dysfunction and the treatment that we have for it in clinic, which is the Priapus Shot. So I'd just like to start by explaining what erectile dysfunction actually is. The definition is the inability to either get or maintain a sufficient erection to have satisfactory sexual intercourse. It's actually a very common condition and it's far more common than people realise. So, for example, the statistics show that at least 50% of men in their 50s suffer from ED, and as you get older, the figures actually go up. But it's not just a condition that affects older men, and it can affect men as young as their 20s, 30s and 40s. So it's extremely common and it's quite a distressing condition to have. So there are many things that can cause erectile dysfunction, and this could be related to neurogenic changes, vascular changes, and there could be issues with hormones, and it could even be psychological. So it's important to determine the cause of the ED in each specific case. The other thing that happens is as people age, the tissues in the body age accordingly, and this also applies to the tissues in the penis. So alongside the different mechanisms for ED, you also get tissue related changes, loss of elasticity, loss of contractility of the smooth muscle in the penis, and you also get a reduction in the volume of tissue, which would lead to a decrease in both girth and length with aging. You also get a reduction in sensation as well. In terms of treating erectile dysfunction, it is important to determine the cause and then target your treatment accordingly. The mainstay of treatment in the UK is PDE5 inhibitors. And these are medications such as Viagra and Cialis and Levitra. Now, the way these work is that they increase the blood flow to the penis during erection and maintain the flow throughout the erection, and they last varying amounts of time depending on which medication you have. Unfortunately, with the medications, they do have side effects, and many men can't tolerate them because of things like headaches, which can be particularly troublesome. Also, they're not suitable for everyone. Now, the main treatment we offer for erectile dysfunction in clinic is a treatment called the Priapus Shot or the Priapus Shot, which works on the basis of platelet-rich plasma. Now, PRP therapies aren't new. They've been around for decades and actually been around for more than about 50 years in fields such as cardiac surgery, dentistry and orthopedics. And many top athletes have used PRP to recuperate from injuries. So the way PRP treatment works is that the platelets in your own blood can be injected into any part of the body and they can regenerate that tissue. So essentially what happens during the process is that we draw blood from your arm, we spin it in a centrifuge to concentrate the platelets, and then from there we inject the platelets which have been activated to make them release their growth factors into the tissue we want to regenerate. In the case of the Priapus Shot, that's the penis. What happens then is that the platelets release their growth factors and they attract stem cells to the area, which encourages the tissues to repair and recuperate. So essentially it's using your body's own natural healing capacity to regenerate any damage that has been done. The great thing about it is that there's very little in terms of side effects and the treatment is effective in the majority of people. So basically that's a brief summary of ED and how the Priapus Shot can help. If you would like any further information or if you'd like to book in for a consultation, then please get in touch with us.